Hi everybody. Happy Wednesday evening. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. We are in our stress relief boot camp this evening discussing chronic illness. So there are a handful of ways that we can approach this. Of course, it's going to have to do with stress because that is the boot camp that we are in. And if you have experienced a chronic illness, feel free to send me a private message if you want specific information on how this affects you. If there's anything that you wish to share, as always, please comment below. Let me know if you're watching live. Give me a hello, a thumbs up. If you have a question while we're discussing, feel free to put it in the comments below. And if you're getting to this later, if you're watching the replay, if you're listening to it on the road, as always, also letting me know when you're watching if there's a more convenient time for us to be doing lives. We try to mix them up a little bit so that everybody gets the opportunity to participate. So we're going to be talking tonight with a handful of information from an individual that I'm a big fan of, Dr. James Chestnut. I've mentioned him on previous videos, so if you're not familiar with who he is a chiropractor, he's an educator, very smart guy, and has some great information when it comes to chronic disease. The way that he describes it to his patients and also those of us that he has had the opportunity to educate is using a rocks in a backpack analogy. So what that means is that every decision that you make in your life, you are essentially either adding rocks to your backpack and decreasing your stress, increasing your allostatic load, or you are making healthy decisions and you are removing rocks from your backpack and becoming healthier. Now, that's a pretty simplistic way of thinking about your health, but it's also very applicable to real-time and real-life applications. What does that mean when it comes to the virus that we're dealing with right now? What role does stress play in that? And how do both of those things impact our immune system? So it was my goal to make it through this boot camp without mentioning the C word, without discussing the virus. And I've talked about it a handful of times, but I want you to understand that the information that I'm delivering here, my goal with this is for you to understand how your choices impact your stress overall, and how that stress impacts your health overall, and not simply in the context of not getting sick with a virus, not catching a virus, or if you do or have had a virus, recovery from that virus. That's not what this group is about. This group is about the bigger picture and health and wellness as a whole, because the majority of us, we are almost at 500 members, and I will tell you that just based on statistics, the majority of us are either not going to get the virus this go around, or and the statistics show that 80% of individuals are essentially unaffected. So if you get it, it is really not that big of a deal. Does it suck to get sick? Absolutely. Is it the life-threatening, ventilator requiring, major resource suck disease that the media is portraying? No, not for the majority of us. Will, unfortunately, a handful of people get very, very sick? Yes, and that is awful. Will a handful of people pass away from complications of this virus? Yes, and that is awful as well. But every single day, people are dying from heart disease, from cancer, from diabetes, from obesity. Those things haven't stopped just because there's an acute threat of a virus going on right now. And that's what this group is about. This group is to help those individuals, those 97+% of people that are maybe not making the right lifestyle choices. So if they did, they wouldn't have the diseases that they're dealing with right now. That's my goal. That's my target market right now. So obviously, based on who I am and the capacity that I function and the way that I treat patients, I am a forever student. Now, unfortunately, my most recent studies have been very laser focused on this virus and on boosting my patient's immune system. And I was watching a continuing education course this afternoon at the office, and I heard one of the best quotes that I've heard in the 8 weeks that we have been studying this. And that was, of all the information that's going to come out about the virus, and I'll touch on a couple other things, the main thing that all providers, so this is your primary care physician, your endocrinologist, your gastroenterologist, your cardiologist, whoever it is that you see and trust with your health and the health of your family. This is what they need to be paying attention to. There is a tremendous difference, and listen to my words very carefully. If you have your pen and paper nearby, write these down. There's a tremendous difference between a well-managed chronic disease and actually eliminating that chronic disease. And I will say that one more time because it is so awesome. The difference needs to be defined between a well-managed chronic disease and eliminating a chronic disease. And why is that so relevant right now? Because the individuals that are succumbing to this virus, now those that are having higher complications, as well as those that are dying from this, are the individuals with comorbidities. Healthy people are not dying from this. That's a fact. That is an undisputed fact. And if there's someone and you've read a publication online that says so-and-so, healthy so-and-so with nothing going on dies of COVID, I call BS on that one, hardcore. Now, why is this so important in this group, and why is this so important right now, and why am I so ramped up about this? I have literally been, this is what my whole life has been about. I've literally been teaching this for 15 years. If you have high blood pressure, if you have, let's use high blood pressure medication, for instance. If you're diagnosed with high blood pressure, and you don't need to say in this group, but if you're diagnosed with high blood pressure and your physician puts you on high blood pressure medication, okay? Now let's take it back for a minute, okay? If you have high blood pressure, you do not have high blood pressure because, and this is not meant to offend any religious entities or anyone whatsoever. I'm gonna clear the air with that right now. If you have high blood pressure, it does not mean that God looked at you and said, Bing, of my children, you're gonna have high blood pressure, okay? That's not how health works, okay? All of us were designed to be smart, well-functioning human beings. If there is a malfunction, that malfunction is actually a representation of our body doing exactly what it was designed to do, but because the stressor that was causing that function was not removed, then things go haywire. Now, what does that mean? When you have high blood pressure for a reason. You have the ability to increase your blood pressure for a reason. And it should be happening based on an increase in cortisol due to a stressor that is finite, that comes to an end. And the majority of us put ourselves in a position where those stressors do not end. And that may be a job stress, that may be a real stress, it may be a unsafe home life, it may be high elevated weight. All of those situations we have the opportunity to extract ourselves from. But because we don't, then that stress stays, or perceived stress. It could be a stress that we imagine because our body reacts exactly the same to real and perceived stress. So we have that stress and it doesn't end. So our cortisol is elevated, our adrenaline is elevated. We are that African on the plane constantly running from the lion, but we never get away and we never get caught and eat and eat. We don't become dinner. So because that never stops, what happens? We end up with chronically elevated blood pressure. And this is, again, a very simplistic explanation of this. So you go to your doctor and your doctor prescribes hypertension medication. So the goal of that medication is simply to lower those blood levels to get your lab work to be in an acceptable range. Studies show that being on that medication does not decrease your incidence of a cardiovascular event. That does not decrease your incidence of having a heart attack or a stroke. What does decrease your incidence of a heart attack or stroke is getting that stressor under control. And it could be exercising. It could be improving your diet. It could be losing weight. It could be extracting yourself from that stressful experience altogether. That's what's going to make a difference, because doing those lifestyle modifications allows the body to do what it was designed to do, and that is to naturally regulate the blood pressure, allow those hormones to ebb and flow. There should be a point of recovery. And as a society, the majority of us do not give our bodies that opportunity for recovery. Does that make sense? Yes or yes? Okay. So, coming back full circle to this addressing of a chronic illness and managing the chronic illness versus eliminating the chronic illness, that management is what the majority of allopathic physicians do. They manage chronic illness very well. That's what all of our United States spending on healthcare is. It's in the management of chronic illness. If your doctor is telling you to modify your diet, or if your doctor is telling you that you need to exercise, or if your doctor is telling you that you need to keep a gratitude journal, you need to virtually hug that doctor, because those are the things that are going to save your life, not only based on the chronic illness that they've diagnosed you with, but all of these acute stressors that you're going to be experiencing left and right. You know, life is meant to be like the Paperboy game. And I'm obviously showing my age based on my reference. But if anybody remembers Paperboy, is that what it was called? I don't even know. If you're on here, give me a comment if I know what I'm talking about. You're riding your bike, and you're delivering papers, and you're avoiding conflict. So, you know, you have to drive your bike so that you don't get hit by the car. You have to drive your bike so that you get away from the dog. You have to drive your bike so that you don't get, you know, hit by the guy that's running after you with the paper that was late or that you threw through his window. That's what life is meant to be. And this virus is one of those things. This virus is that dog that's chasing after you, nipping at your heel. Yes, Paperboy. Thank you, Jade. Mwah. Obviously, we grew up in the same household. So, if you are making these healthy decisions, then you will be riding your bike and you will have the ability to ride faster when you need to. You will have the ability to steer appropriately and get away from those dogs that are trying to chase you or cars that are trying to run you over. Now, if you're not, and your answer is simply popping a pill so that things appear to be under control, you will not be steering effectively, and you will not be able to ride your bike away from that stimulus and escape those stressors. So my goal for you in this group, as you're watching my videos and tuning in, you know, some of it was meant to be a human connection. It's nice to talk to somebody every day. There's a lot of individuals that have been commenting that are living alone, that are missing people, that don't have that connection. And so I'm glad that I can be here, you know, as a source of connection to the outside. But really, my goal is that you're watching these videos and learning a handful of implementation steps. And again, a lot of them I'm hoping are sounding familiar, are seeming, you know, realistic and implementable. The underlying truth in all of these videos is that you have the power to modify your health. You have the opportunity to change your destiny for some of us. If you are choosing the donut over the apple, there are consequences that come with that. You know, if you're sitting home watching this right now with a glass of wine and a steak sandwich, there are consequences that come with that. And I've said it a million times. There's a lot of memes online about, drinking in the morning and you're schooling your kids and what time can you start drinking. And it's funny, haha. But the reality is, if you are scared enough to be home and you're scared enough to keep your family safe in the home, then you need to be implementing the right choices that are actually keeping them safe. And that's being proactive. Locking the door is not the answer. The answer is keeping sugar out of the house. The answer is making sure that everyone that you come in contact with recognizes their importance. It's so that you recognize your own importance in your story. It's so that you get up and you go for a walk every day. You take 5 deep breaths. It's very, very simplistic. It's not easy to be healthy. It's a very simple concept. And our job, both at North Shore Proactive Health and at Salutogenic Life, is to provide you the tools in order to implement those healthy choices and make it so that you want to do it and make every bite of health that much simpler. So a couple quotes I wanted to share with you before we wrap up tonight. Each year, the U.S. spends more than $6,700 for every man, woman, and child on what is essentially sickness care. In contrast, virtually every other industrialized economy spends less. Greece spends less than $600 per person, yet achieves superior outcomes in virtually every recognized international standard of health outcome than does the United States. Every other industrialized economy that expends less money than the United States also achieves better health outcomes. So I'd like you to consider why that is and what that means. When it pertains to chronic illness, do you feel that chronic illness is something that you catch or something that you develop? Is chronic illness the result of an acute event or the result of chronic habits? And if you have thoughts, feel free to chime in the comment box below. Now, when it comes to the high blood pressure explanation example that I was going over earlier, the aim of prescription drugs is to override our ability to adapt to or physiologically express our environment. Drugs actually block the ability of our genes to adapt our physiology to match environmental demand. So that's exactly what I was talking about with your high blood pressure medication. There's a reason the blood pressure is elevated. What should be done is addressing that reason and not simply treating the symptom of high blood pressure. And I used this book a little bit earlier for a handful of examples. I actually have 2 of these. I like the book so much. So, in getting a little specific on our stress response, I'm going to go over these really, really fast. But our left prefrontal cortex can inhibit the stress response by releasing GABA at the amygdala. In other words, we as humans can consciously choose to react differently to stimuli and lower our own stress levels. So you can address your perceived stress and allow it to bring you down to increase those stress hormones, or you can acknowledge that it's there and let it go. That can be difficult during periods of chronic stress because neuroplasticity develops along the amygdala. Okay, blah, 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 blah. What does that mean? I want you to practice the information I'm giving you and implement it now and continue to implement it as this time of stress wanes. This is obviously a very, very stressful time for everyone. And it doesn't matter what your situation is. All of us are under a tremendous amount of stress. So this is sort of game time. This is go time. This is when you should be implementing all of the healthy choices that you've been making, all of the preparedness that you've been doing. But unfortunately, if the information I'm giving you right now is new and unique and you're not familiar, you may not be as skilled as implementing it. One of the easiest things that you can do right now is focus on your breathing. So I taught it, my friend Erin taught it when she was on, breathing in that square. So breathe in for a count of 4, hold it for a count of 4, exhale for a count of 4, hold that for a count of 4 before you take that next breath. Now, if you focus on that and you practice that, you should be able to implement that when times of stress increase. And obviously that could be now, or things could become even more stressful. But practicing breathing is one of the best things that you can do. It will lower your cortisol, it will help you relax, it will decrease heart rate. So give that a try. Make that one of your implementable steps. I ask this periodically as we're going through the days in the group. And if you have something that you would like to discuss, if you have a positive quote that you come across, if you have a question for everyone else, please at any time, feel free to post it so that all of us can benefit from that. To wrap up this quote here, the only way to break this cycle, so that we talked about, and the neuroplasticity is the change. It's your body getting used to the stress. So the only way to break this cycle is to create neuroplasticity along stress response inhibition and logical thought stimulation pathways. So what does that mean? Exactly what I just said. We want to train our body to relax. We want to train ourselves so that when that stress stimuli comes, you're like Mr. Miyagi. And it just goes. You can catch the flies. There's another reference to my age. You can catch the flies and just let it go. But you can't do that if you haven't trained yourself under less stressful events. The adjustment, and we are speaking chiropractic adjustment here, can do this. Drugs cannot. They can simply artificially supply the neurotransmitter or inhibitor, but they will never, ever create a healthy pathway. So that's what all of us need to do. We need to take responsibility. We need to put our big girl panties on, and we need to take our health seriously. That means you, and you. There's a lot in here. We could talk all night long. There's some great information. Again, that's why I have 2 of these books, because I love it so much. So we have some great guests still coming towards the end of this week. Annette is going to come back and help us make nice cream. My friend Robin is going to be on, and wrapping up the week, I think Friday afternoon. So tomorrow I'm going to be live from the office. We're going to be talking probably around lunchtime. I'm going to be doing a virtual health fair around 1 o'clock. So if you have a topic that you would like to hear about, if you have something that you would like to discuss, and you get it to me prior to noon tomorrow, it may be tomorrow's topic. We're also going to do a super awesome giveaway when we hit 500 members. So stay tuned for stipulations to enter that. I'm stealing that idea from a friend who does it on Instagram. If you enjoy the information that I provide, if you want other sources for this, of course, Dr. Jordan Leasure is my Facebook professional individual page where I post a whole bunch of studies that pertain to health. If you want to see what's going on more of the wellness personal side on Instagram, I'm on Hot Doc Chicago. If you have a Peloton, you can find me at Hot Doc Chicago as well. And there's always something brewing when it comes to health and wellness. And all of us need to be ready to implement as much as we can, as much as we're comfortable with, whatever makes us happy and feels right, feels good to us, because that's how we're going to get through this. So I'm going to leave you again with that quote that it was actually the motivation for tonight's video. And that was, there needs to be a very clear distinction between well-managed chronic disease and eliminating chronic disease. And the goal, again, needs to be on the elimination of the disease and not just the management. Because the management of a disease means that you still have that diagnosis and you are more susceptible to those acute stressors that will continue to come about. Whether that is this run of COVID, whether that is when we have a resurgence this fall, whether that is the flu, which is still around and is going to be back, or any other bacteria, virus, yeast, parasite, whatever it is that you are exposed to. You want to make sure that you make this fortress as strong as possible so that it can withstand an attack from anything. I hope that you have a beautiful evening, have sweet dreams, and if there's anything that I can assist with, as always, feel free to private message me or post on here, and we will improve our health one day at a time. Love you all. Have a great night. Bye-bye.